Hi, I'm Dr. Wesley Shankland. I have an office in Westerville, Ohio, which is a suburb of Columbus. And I've made several videos that are on the internet, but I want to show you one today about a disorder that's somewhat common, but it's often misdiagnosed by dentists and physicians alike. It's called Ernest Syndrome. It's named after my mentor and the man who primarily trained me, Dr. Edwin Ernest of Montgomery, Alabama. And Dr. Ernest is probably the smartest man I've ever known next to my father. He's a wonderful guy. He's a neat Christian, and he just knows more about oral facial pain than I'll ever know. But Ernest Syndrome deals with a structure called the stylomandibular ligament. Now, this is the styloid process as it's on the base of the skull. We all have these, one on each side. And attached to this structure are at least 8 other structures, and one is a stylomandibular ligament. So the name styloid process, mandible, stylomandibular ligament, hence stylomandibular ligament or Ernest syndrome if it's injured. And the way this is injured is somebody has a whiplash injury where they're hit in the rear and their mouth is open like that, forcefully and closed, or if they receive a blow to the jaw like you just saw there, something like that, or somebody is intubated during surgery, a necessary procedure, but their mouth is stretched open and maybe brought forward like this for the intubation. That can stretch the stylomandibular ligament and produce a problem such as ear pain, eye pain, pain in the temple, pain in the throat, pain in the cheek area, and some patients even have other symptoms which you're going to see in a little bit. So this Ernest syndrome is a interesting disorder which we can treat very successfully, and I want to show you a patient here who's kindly agreed to let us do a videotape of her treatment, which I've never treated her for this before. So we'll talk about Ernest syndrome with this lady.